All right, let's begin our afternoon with a presentation from Christian Lanphere. He is the emergency manager for the Cambridge Health Alliance. He serves as the CEM Commission Chairman of the International Association of Emergency Managers. He's also licensed as a critical care paramedic, certified emergency manager, and holds firefighter 1 and 2 credentials. He joins us this afternoon with his presentation, Preparing an Active Shooter Exercise in the Healthcare Setting. Please welcome Christian.
Thank you. Good afternoon, everybody. So I'm a little more interactive. I don't like to stand behind podiums, so I will be out in the open. It's so good to see so many of you. I am one of those fortunate folks that gets to go to many of the meetings that both Region 4AB, the Boston group, and even I've been invited to the Region 5 group, all of those hospital preparedness meetings over the years, and all those funny state requirements that we have to abide by. What I'm here to do today is talk to you a little bit more. I'm going to take a different approach. I'm going to help you design a active shooter exercise in your facility. So to begin, let me just tell you a little about the Cambridge Health Alliance. We're a community hospital system. We're a public safety net hospital. We have 3 campuses, a number of ambulatory care sites. We're located in 6 communities north of Boston, and the Cambridge Public Health Department is affiliated with the hospital. So we're probably a very unique system, and we're quite complex. So what we have here is Operation Safeguard. And the reason why Operation Safeguard really sort of came about was because there have been national trends in workplace violence. We, in our own institutions, have seen folks have come into contact with some type of threats of some sort, just as many of you have. We do have a very large and vulnerable mental health population. And we, like any other institution, has disgruntled employees. And we have domestic violence issues, not only with patients, but also with our staff. So we are taking a very intense approach to sort of address some of these issues. You can see that obviously the media coverage when an active shooter event happens is quite large. And we all know that especially, and I'm one of those news junkies, we all clamor toward the TV to get as many facts as we can about these situations as they're unraveling. And of course, some of the high-profile events that have happened in hospitals, certainly the one that we got to hear this morning. But the 3 I think that I really focused on was the event at Johns Hopkins Hospital. I won't rehash what happened there, but in that particular event, I consider that a workplace violence event, something that is concerning for me to sort of go after and help try to protect our doctors, our nurses, PAs, NPs, any other providers who provide services to our community. There was the domestic violence event with the trauma surgeon who killed his girlfriend at the Erie County Medical Center, which was a domestic violence-related event. And of course, we have which I think really changes the landscape a little bit. This was the Mercy killing at Akron General Hospital, where the gentleman him and his wife had made a pact that they would take each other out in the event one of them became a vegetable. In this particular situation, she was on life support, but she was going to survive, so he went into the ICU and shot her in the head. So those are the sort of the premise that I sort of took around putting our policy together. So, and I know that there's a lot of debate out there about the use of code language versus plain language. I'm certainly happy to debate anyone after the session about why we went to the code language. But we implemented Code Silver. This was it took about 1.5 years, I would say, to put this policy together. We then began to apply the Code Silver to all aspects of the organization, clinical, non-clinical, and business entities, as we are quite broad in the community. We had to think about how we were going to train our staff and how our staff would be made aware I am cognizant of the fact as I go around talking to our healthcare workers, it's not an easy topic to discuss with them. So I was looking for experts who really understand this field to come in and help with this, and I'll talk a little bit about that. And then I had to get the buy-in from the staff. I think the number one question I got was, why do we need a policy like this? So we, along with my partners in the Conference of Boston Teaching Hospitals, because we're all sort of working on this together and we've been sharing our plans, I thought it was prudent that we took similar steps. So when we did Operation Safeguard, there were a number of agencies that supported our efforts. Obviously, we had staff from all over the Cambridge Health Alliance. We had the Professional Ambulances Center for Medics program, their paramedic students, the Cambridge Police Department, which I'll talk about shortly, the Auxiliary Police Division within the police department. The 911 Center actually got to participate in the exercise, and I'll talk a little bit about that. And of course, our partners at the State Department of Public Health. So our overall strategy, I think when we began, was we approached the police department, and there was a sort of, there's two deputy superintendents, I think they're actually here, Joe Wilson and Paul Ames, who were not only two folks that I admire, but I've learned a lot from. So we went to the police department to pitch to them our interest in conducting an active shooter exercise. And they, for the most part, have been very actively training in the community. So we I decided that they probably haven't really practiced in a healthcare setting. And we went to the police, and the first thing the police did when they brought some of their lieutenants and colleagues into the room was, absolutely, when can we do this? So they were our partners from the very beginning, and we were able to start the planning process for them. Once we got their approval, we then had to start putting a plan together for the senior leaders. Now, I'm at the Cambridge Health Alliance. For any of you that know my chief operating officer, she is, she's superhuman. She is incredibly methodical, and she is detailed much more than a computer processor could ever be. So she really put me to work on this particular exercise, and she was incredibly uncomfortable with the exercise. And we sort of had to get to the point where she was comfortable enough to allow me, to give me the trust and allow the police department in to come conduct this exercise. Our chief nursing officer and our chief medical officer and the chief of the emergency department, they were ecstatic, and they were more than happy to jump in on this and support us. So for those of you who are the senior leaders out in the room, I really do encourage you to take an exercise like this and really give your people the tools they need to run it. So I went out and started looking for other active shooter exercises to sort of watch and learn from. One of them was Norwood Hospital. They had a smaller exercise. Then I went to Boston Medical Center, and really, Maureen McMahon over at Boston Medical Center was really she's really sort of the architect and who created the blueprint that we took from their institution and applied it to our exercise. So I wanted to give a shout out to the folks at the Boston Medical Center. We brought in APG Security. They did a fantastic job of conducting seminars for our staff. They were able to bring it down to a level that our folks could understand. And when I went to their first presentation, it was had a lot of police jargon. They were able to really take that out and really apply it nicely to the healthcare environment. And so we did several of those over time. And then we started our Code Silver training and started training our staff on what to do if there's a Code Silver. And I'll talk a little bit about, we do allow any employee in our institution to call the code. Obviously, it has to go to the operator. The operator will do the overhead announcement, and she will give the location of where the event is coming from so that folks in other parts of the hospital know what they need to do, whether to lock the place down, whether they need to run. We do use the run, hide, fight mentality. I use that simply because I think it's easier for our staff to remember. We also use a training video from the city of Houston, which I think that you'll find on YouTube. You can certainly get it from them. They've been more than happy to share it. But I think it's a nice illustration of, in a very short amount of time, to train our staff on what we want the response to be. We had a targeted date for our full-scale exercise, which was about 6 to 9 months out. And then we started to, something we did a little bit differently this time than I think I've seen in other exercises. We integrated the folks from the emergency department. I think Dr. Luis Labone, who is one of our superior physicians, sort of led the team to begin that process of how do we take medical personnel who are, and for those of you who work in the ED, and I was an ED guy, that we're very used to the patients being packaged up nicely, and then we fault the EMS guys for whatever we can. In reality, they had to see a little bit differently where they were going to go into the situation, and they were going to be the first responders. So it was a great opportunity for them to collaborate and see a different side of their work. So the venue we chose, now mind you, I only have 30 minutes, and I think they gave me 30 minutes because I talk too much. If you're going to find a venue, you need to find a building that is applicable, that is sort of carbon copy of your institution. You'll see in this building, we used an ambulatory building, which we felt was appropriate for the training. We needed to be able to secure every inch of that building. And I learned one thing. When you take an entire group of police officers and you take their guns away, you better have presidential-style protection of that entire building. Every single square inch of that building needs to be secured so that no one inadvertently gets into that area. The police don't know that the police may think they're part of the exercise. They have no idea that this is an exercise. It could be a very bad outcome. So securing every inch of it is incredibly important. Something we had to bring volunteers in. We obviously wanted something that the volunteers could easily get to. We provided them parking. They were able to come in very quickly, and so it was a seamless move. Sound effects. I've been to exercises that have simunitions. I've been to exercises at UMass where they didn't use any type of gunfire. And then we went to, in our exercise, as well as those with Boston Medical Center, we actually took a 38 revolver blanks, and we actually fired the gun in the building. And I know that may sort of frighten people, but I think, in the words of the police department, you really don't get the true effect of what this is really like until you hear the sound of gunshots. And so we needed a building that the guns could go off, but it would not be able to disturb other parts of the hospital, and other people would not know that there was something going on. So keep that in mind. Time of day. We ended up doing ours at night in the evening time so as to minimize the impact on the clinical and business services who were occupying that building. And then we had to begin the process of recruiting our staff and volunteers who were going to actually participate in the exercise. What we did was we took staff who were well-trained in the code plan, and we took staff who had minimal training in the plan. We put them all together. So we had about 26 staff members who stayed to participate in the exercise. We brought in folks to command our incident command center. That is a little bit of an artificiality. We do want the command folks to participate, even though most likely they probably would not be able, if they're outside the building, they would not be able to really operate. So something to think about is, do you have an incident command post or incident command center that is outside of your building that your folks can manage, because you're not going to be able to manage it while you're in that building. Hopefully people aren't hanging underneath the CEO's desk. Volunteers. Volunteers were critical, and I'll tell you a little bit about the volunteers. We chose our volunteers very, very carefully, and specifically because I did not want anyone to be frightened or to have a reaction due to the fact there were a lot of police officers and there were a lot of weapons in the room. So we chose our volunteers very carefully. We chose volunteers from, obviously, the paramedic students. A lot of them have exposure to the law enforcement community. They were a great asset to us. We used folks from the Region 4B Medical Reserve Corps. Those folks came in, and they were able to complement very nicely. We had folks from the various hospital security departments, as well as folks from the hotel industry, that in a private security firm that sort of complemented our volunteers who were going to play our actors. Door monitors. I think this is where the Cambridge Police Department's auxiliary police really came in very nicely. We not only used them, but we used the hospital's employees to man every single door that anyone could potentially walk into that area had to be manned with someone. And these are some of the lessons that we took from the Boston Medical Center during their exercise. And then we had ancillary staff. You got to feed these. You got to feed these folks. The best way to keep your volunteers happy is to feed them. Okay, and the police too. And we also consider maintenance and facilities personnel to be available in the event that their gunshots are going off. That in the event that the fire alarm accidentally goes off, sprinklers, whatever it may be, you want to have them immediately available so that this could occur. And then you need trained safety officers. The police department provided safety officers for the police side. The hospital provided safety officers on the hospital side. And I do have some pictures I will show you here shortly. So what I would say is that the two things that anyone absolutely needs to be the priorities in an event like this, because it is a hospital, it is safety and communication. So communication is probably one of our biggest sort of, I think, plans that we really had to put together to ensure that every person who came into our buildings understood what we were doing, that the people in the community understood what they were doing. If any of you know Cambridge, we're a highly opinionated community, and people do call 911 for the littlest of things. So we needed to make sure that the community around the hospital was well aware of the police activity taking place, and that it was not real, that it was just part of a drill. So we did organization-wide messaging. We had to communicate to the tenants in the venue building that they would have to vacate their offices at a certain time. And right from the senior leadership, the directives were given to the physicians in the room. This is for the physicians in the room. We gave directives to the physicians that you could not, once the exercise was going to begin and the area was going to be cleared, you could not stay in your offices to do anything. You had to leave the premises so that the entire building could be secured. We put messaging up on our intranet site so that all staff getting onto the internet would rapidly see it. We put it on our electronic newsletters, and then we went out to the media. So I've also learned that if you proactively go out to the media, they most of the time will not bother you. We happen to be lucky in the fact that this particular exercise occurred the same night as the second presidential debate. So we were lucky that the media did not show up. But I've been to many other exercises where the media showed up right away. But we did have contingency plans in place in the event that they do show up. So letters to the neighbors. We are in a highly dense residential area. We are not only in Cambridge, but the back of the hospital goes right up to the backside of the city of Somerville. So we had to communicate to both jurisdictions how we were going to conduct this exercise. And the letters were personalized from the CEO to each neighbor so that they would have any questions. There was a number that they could call. So we were obviously doing our good neighborly and being good neighbors in the community. So we had to think about, because we had multiple jurisdictions, were we going to do citywide messaging so everyone in the community could hear it, or were we just going to isolate it to certain neighborhoods? And that was something that we needed to talk about, and I'll talk more about that. We had to make sure that all of the first responder agencies that were not participating in the exercise were well aware of what was going on so as not to add any confusion to the exercise. The police department involved the 911 center. The 911 center was involved on two fronts. One, they participated because we allowed folks to call 911 as part of the exercise. We also wanted to make sure the 911 center was well aware that if anybody heard gunshots outside the building, that this was just part of an exercise. So the code red, the city of Cambridge decided to do a local neighborhood code red messaging to the residents in that immediate area, whereas the city of Somerville did reverse 911. So they did a reverse 911 to the folks in the community around the hospital. Patient notification. Patient notification is huge. We gave patients individual letters on their morning, lunch, and dinner trays. And then we had the nurse manager of each inpatient care unit go to every single patient, explain what we were doing, and if they had any questions about the exercise, so that all patients were well aware of what we were doing. We did an overhead announcement just before the exercise was going to begin and end, so that folks who were not participating in the exercise fully understood that the exercise was beginning and ending. And then everything which is normal protocol in an exercise, every exercise communication had to begin with "this is a drill." If it didn't begin with "this is a drill," we had to make it very clear, is this part of the exercise? And then we did external and internal signs. We had signs at every single entrance and exit of the building. And we had out-of-play signs so that for those of you in medication rooms were going to be off limits. We did not want the police going into those during the exercise play. All of that was covered. So we did a final walkthrough with the design team. We did a law enforcement review. We did not allow the police into the officers who were responding to the event to come tour the building. Obviously, they wouldn't regularly know the building, so we didn't want them to know it. But we did allow the safety officers to come in, not only to review the floor plans of the hospital, but to actually fire blank weapons. We did a shotgun, I believe it was a 45 and a 38 in the building at various levels to see what the sound would be like and where it would impact, whether the ORs, because they go up against the wall, or any of the inpatient care floors. So this was the building that we used. We had our security plan. When the police come in, the police need to have their own room. They need to have a room that they can secure by themselves. Once they take that room over, it is their room until the exercise is over. So make sure that it's a room that they can secure very easily. And then you need to have an area where staff and volunteers can congregate while we get the exercise set up. We began the sweep of the building at 5:30. If any provider was behind on their schedule, we held up and waited to allow those providers to finish up those patient appointments and then escorted those patients out of the building. All offices had to be clear, as I said. There was a door-to-door search. Even offices that were out of play still had to be searched to make sure no one inadvertently was in any of those offices. Once that floor was cleared, people manned posts, and they were not allowed to leave that post until the exercise was over. All the exercise participants were badged. Now, because we're taking the police officers' guns away from them and giving them blue rubber guns, and you'll see that in a few pictures, everybody, including the exercise design team, staff, and volunteers, had to be patted down and searched. Everyone was told, leave your communication devices at home. There would be no pictures allowed during the exercise, no recording devices, and any weapons that you may have need to stay in your car or at least out of the hospital. So everyone was badged, and I learned that there's a lot of healthcare workers who carry scissors. Just putting that out there. And then obviously the safety of all the doors. So this is just a quick little security plan where we posted guards at every point in the exercise. I'll just give you a quick brief that we had to make sure that any entrance into that building was guarded with some presence, and no one was allowed into that area. But as we were talking about not only badging people, but everyone had to have a white wrist bracelet that signified that you had been adequately searched. If you decide that you have to leave the exercise area to go to your car or something, we cut that band off, and you had to go through the search again. So it was very, very tight. So we had 67 volunteers, 26 staff members, about 25 to 30 patrol officers from the police department who came in. We did a safety briefing with all of them. As I told you, safety is paramount. We did a registration table for them all to check in. If you were not on that list, you were not allowed to participate in the exercise. So there was no walk-ins allowed. We needed to know up front who everybody was. Everybody obviously went to the third floor where they were checked. They were given their briefing by the city's police department's exercise safety officers. And then all the safety officers, both on the Cambridge Health Alliance side and at the Cambridge Police side, had the authority. Anyone who overacts the exercise was going to be tossed out of the exercise. We just couldn't take that liability. We didn't want officers to be grabbed. We were very explicit about ensuring officer safety. The police obviously went through their protocols. They went through the traditional Homeland Security exercise weapons policy check. We had the safety officers that were there directly for the officer's safety as well as the shooter. One of the things that I found extremely interesting in this exercise, when we were recruiting volunteers, particularly staff, to participate in the exercise, every single staff member wanted to be the shooter. Every one of them. Everyone. So that gives you an idea of what the folks I work with are like. And then we had protocols in place for the Cambridge Health Alliance side. The safety officers responsible for the actors' safety. There, we had brought in folks from the Victims of Violence program to do psychological safety to make sure anyone who was having a hard time with the exercise was able to continue. anything with a real-world emergency. And then we had observers. Observers were allowed to come in, but they were not allowed to leave any partitioned area. So the exercise began. I got to move this up a little faster. We positioned our actors. We used a realistic scenario by targeting a physician. So the physician didn't know she was going to die that day, but I did. And she was vehemently pointed out because we wanted the exercise scenario to be as realistic as possible. But we didn't tell the police what the scenario was. We wanted them to sort of gather all the information the way they would normally get it when they get on scene. We positioned our observers, safety officers, photography. Tom Leslie Photography is the group that took the pictures. Be very cognizant of the fact that your local law enforcement agency may not like pictures. And any pictures that get outside of their control it's a dicey issue. So make sure that you work with the police department to make sure any pictures they're taking of any tactical operation involving the police department, that you get their buy-in on this. They would not allow observers to take pictures during the exercise. So we staged the police instead of asking them to respond in vehicles. We didn't want the threat of having a whole assortment of officers running into our building, so we staged them. We had to verify that all agencies were ready, and we began the exercise. So as you can see, this is Joan. She's one of my colleagues at South Shore. We were positioning our safety officers from the police department. And then you can see we moulaged up front our victims. We gave them little victim cards and allowed them to participate. Then the shooting began. This is the arms instructor at the police department, and I'll tell you, this guy deserves an Emmy. He was downright frightening. And he was extremely realistic, and he kept firing that gun. And I think, as one woman told me, you know, my sons are police officers, and I knew I could do this, but this is just a little too real for me. And she said, I thought I could do it, but I'm struggling with it a little bit. And so we fully understood that. Again, there was the safety officers following the shooter. And then we had a hostage. These events, the shooting was over well before the police even got there. We timed the police what their normal response time would be, but the shooting was over and the shooter was already gone by the time they even got there. So we had to extend the exercise to allow it to play out. So we added a hostage, and our hostage is actually in this room some ways. You can see that the police are responding to the event. They took this. The police department was fantastic. They really took this incredibly serious. And it was much of a learning opportunity for them as it was for us. You can see any victims that they found, they literally stepped over them and moved on with their search. As you can see that they're continuing down their search. And they're in different formations. Anybody that they came upon because they didn't know where the shooter was, they treated them as a suspect, cleared them, and then got them out of the area safely. You'll see that Caitlin Ahern, she's one of our safety officers. She's overlooking the safety and welfare of the victims. The police had to go through each and every single room to look for the shooter and identify was there anyone else in that building. And that took them a considerable amount of time. And this is only 3 floors. So keep that in mind. Again, they were escorting the volunteers out to safety, and then other volunteers were allowed to continue to bleed until we could get it safe enough for the medical team to come in. One of the things, I think the most common theme I got from everybody, and these are just typical exam rooms, the people, we didn't train any of these people, we didn't tell them what to do. These people hid so well in these exam rooms that the police had to go in several times to find extra people in those rooms. People hid extremely well. This is them going up the stairs to the next floor as officers are responding. This is when the shooter allowed the hostage to get away to see if they could get him, and he's on the floor being treated as a suspect until they could clear him. Again, you can see that the police are going through every single door. A few more pictures of where they're allowed to they open the doors, and they patted people down and then allowed them to get up and move out. This was actually a facilities closet I didn't even know existed. They found their way into that. And so the police really did search every inch of that building. And then they escorted them out of the building. And then we did this is Charlotte Roy from Newton Wellesley. She was one of our trusted eyes and ears out there, and she sort of gave an overview of what she saw. So what did we learn from the exercise? We learned that rubber guns look just as real as a real firearm. As one of our victims said, I knew it was a fake gun, but looking down the barrel of that gun, I thought it was real. Because we used the 911 system, and people actually physically dialed 911 to report it when the 911 center set the exercise off, there was panic in the telephones. The 911 operators really had to take a minute to really try to understand and get a grasp of what was really going on. And we had multiple people calling them so that the exercise really played out real. Again, staff hid very well. One of the lessons we learned from Boston Medical Center that we applied to this exercise, similar to, I think, what the gentleman from Alaska said this morning, is that now we have in each of our security areas, there's sort of like a fire where you can hide it. You put a fire extinguisher, and you break the glass. What's behind that piece of glass is card access cards that give you access to anywhere in the hospital, as well as master set of keys to get into every single door. Much like everyone else probably in this room, our security personnel, we do have law enforcement personnel who complement our public safety department, but they're not armed. So we are not encouraging we're not asking our public safety officers to go to the threat. So the police need to have the ability to have a map, keys, and card access to move throughout the institution without the need for help. The exercise became real. People created their own drama. People created 4-year-olds where they didn't exist. People were looking for 4-year-old that actually didn't exist in the exercise. And then we didn't actually put our shooter out there, but people described it multiple shooters. So the police thought we were pulling a fast one on them, and they were looking for 2 shooters. So these things, again, it was just very real in a real situation. We did the unified command. We had someone from the hospital and someone from the police department who sat side by side and tried to command the operation together. And the importance of having a SIM cell that allowed our folks, everybody's got to call the State Department of Public Health when these things happen. You've got to call all the other regulators that need to be involved in an exercise like this. That SIM cell played that piece of it out. Not only the State Department of Public Health also helped by putting out messaging through the Health and Homeland Alert Network to all of the folks in the Region 4AB area. Then the last one here is medical expertise. Even though the folks from the emergency department are clinically astute and do very well at their job, they were completely overwhelmed by the mass number of people who were in need of their help. They didn't have any real familiarity with that department, even though they work in these buildings. The department floor plans were not something that they're used to, so there was fatigue everywhere. And then security of the medical teams. We were going to attach police officers to escort the medical teams up to attend to the victims. That sort of happened, but the police officers sort of let them go. So they were sort of feeling a little bit vulnerable, but they really had to put their triage skills to work in this exercise. 2 things that I think that we learned, because when these exercises all sort of become a little too real, we learned that in the middle of this was an earthquake. And then towards the end of the exercise, we had a code blue from one of our victims. So the exercise was immediately scrapped at that point, and the code blue team was able to adequately attend to the patient. We did have EMS personnel who were there for actor and officer safety, and not so much to be part of the exercise in triaging patients.